Stress is one of the major reasons for people losing hair these days. You share combs with everyone, you're staying in a PG. Biotin actually has nothing to do with hair. So these are all just marketing scams, I would say. But when they started recovering from COVID, that's when everyone started noticing hair fall. So if you have hair fall, first stop that. So hair transplant is not a solution for hair loss. So actually, to be honest, everything affects hair. But it is not going to bring back hair that you've lost. God made us in such a way that, you have the solutions to your problems inside of yourself. Hi, this is Dr. Nikita from Max Hair Clinic. Today we'll be talking everything and anything about hair.
What is the most common hair concern that people approach you with?
Majorly, it is androgenetic alopecia. So, if you look at the statistics, around 90 to 95% of hair fall is male pattern balding. It identifies as a M-shaped pattern. It's the most common type of hair fall.
Is this issue typically associated with the Norwood scale?
Yes. Male pattern balding is classified based on Norwood scale. So we have two. So for the men, it's Norwood's, and for the women, it's Ludwig scale.
Could you please elaborate on that a little bit more?
So Norwood scale is a classification where we generalize male pattern balding. So we have stages from 1 to 7. So majorly people in stage 1, it will not be identified much. You will not be able to notice much of changes. The person alone will be feeling a lot of hair fall and a lot of thinning. When he starts to experience a little bit of hairline receding, that's when he's in stage 2. When he's in stage 3, you can have a prominent M-shaped pattern. Stage 4 and 5 is majorly your crown getting affected. Stage 6 is almost 70% of the balding, and stage 7 is when you've lost it completely on the crown, on the top portion.
For individuals who have experienced complete hair loss, what treatment options are available?
Depends on their donor, on their general health as well. So we restore what they've lost. So majorly focus on restoration programs. In Max Hair Clinic, we can do it both clinically and non-clinically. So clinically is your hair transplant, and non-clinical is your cosmetic hair restoration.
Can stress genuinely lead to hair loss?
Yes, stress is one of the major reasons for people losing hair these days. Those days it used to be falling sick, or maybe using the wrong product, or a parasite sitting on your hair. But now, as everybody's jobs have evolved, their lifestyle has evolved, stress is the major reason people lose hair, be it men or women.
When consulting with patients, would you say that the session feels more like a counseling experience than a traditional consultation?
What I feel in my 7 to 8 years in this field is people don't exactly come and ask, I've lost my hair, I'm feeling bad about it, because it's still a taboo to talk about hair loss. So people mostly say I'm happy with how I look, but my family is forcing me to get treatment. So that is majorly how they come for it. And people especially planning to get married, they're the ones who are giving up all kind of oils and tablets, and they come for treatment. So more than a consultation, I feel like first I have to understand what exactly the patient wants. So it's more of like a patient-doctor conversation, I would say counseling.
Is there a particular patient story that, stands out, like someone who truly opened up about their experience?
So there's this one story which happened about 1.5 years ago. There was our client, he was 71 at that time. So he had a late, his wife had a late pregnancy. So when he was 71, his kid just started going kindergarten. So in their school, they used to have this practice where, they draw whatever they feel. So this kid drew his parents. So he drew his father with hair. So this particular person, he was not much into hair, or he was not, concerned about the way he looked. But when his kid drew him with hair, that's what shook him. So when he came to us, he was like, I don't know what you're going to do. I'm ready to spend how much ever, but please give me hair. So I wanted to be realistic because for his age and he was completely bald. So we had a good discussion and we ended up giving him a hair transplant with all the donor that he had. We gave him a good density in the front. So it was a 2-step surgery where we focused in the front first and then we went on to the back. So when we gave him hair, about 7 or 8 months after this surgery, he actually came for this review which we have, and he said that I look exactly how my kid drew me. So that is one story which it's deep in the heart.
So, how can one differentiate between normal hair fall and hair loss that signals an underlying issue, ma'am?
So hair fall, I want people to know the clear difference between hair fall and hair loss. So hair fall is something which is completely normal. Like every hair that is on your body or your head is supposed to fall. It's just like how your teeth falls when you're a kid. But when it doesn't grow back, that's when you should be concerned about. So then you start calling it hair loss. So hair fall, about 50 to 80 hair falling per day is considered normal. But when it's not coming back, that's where the balance goes off and your skin starts to get exposed and it starts looking less dense. So when you feel an extra number of hair starting to fall out, it is better to have your treatment done. But I would say yearly, whether you have hair fall or you don't have hair fall, a yearly checkup is always good, just to make sure your vitamins, your skin, your hair, everything's under control.
So, when should someone consider their hair loss to be serious or possibly linked to a medical condition?
I mean, normally there's something called telogen effluvium, where you don't have an issue, but when you come out of a health issue, like say for example COVID happened. When COVID happened, when it actually happened, people didn't lose hair. People were more focused on their breathing and their gut. But when they started recovering from COVID, that's when everyone started noticing hair fall. There is a statistics that about 60% of the global population lost hair. So when your body comes out of a certain stress, your not so important stuff like your hair, your skin, your nails start to get damaged. So when you notice a lot of thinning, especially in the frontal region or some places where you have white patches on your scalp like dandruff, you'll have to be a bit more concerned about it, because you will not take it seriously initially, but then you'll reach a certain stage where certain treatments will not work. So it is always better to, when you feel something different from your regular schedule, to get it checked.
Are hair care products alone sufficient to treat hair loss effectively?
To treat hair fall, no. But to maintain your hair, yes. Like there's a lot of good oils. I would say to keep your hair nourished, shiny, prevent it from breaking or split ends. There are a lot of supplements where if you're deficient in any supplements, you'll have to take. And there's a lot of shampoos which are safe for your skin. Always it's better to go for products which is recommended by your physician than you buying it something off the market or something which is trending on social media.
In your opinion, ma'am, what is the most overhyped hair product in the market right now?
I know I'm going to get a lot of backlash for this, but it's actually biotin. Biotin actually has nothing to do with hair. But the way it's marketed, I mean, everybody would just go buy for it. But actually, it has nothing to do with your hair loss. The ingredients which is actually good for your hair is vitamin D, magnesium, zinc. But actually, biotin has nothing.
Are you referring to the currently trending hair gummies?
Gummies, I mean biotin as such. It can be gummies, it can be your tablets. Some people take it as syrup also. I've heard some shampoos having biotin. So these are all just marketing scams, I would say.
Could you help us understand the different types of hair loss, ma'am? Like androgenetic alopecia, telogen effluvium, and alopecia areata.
So, I mean, for the patient, it's just going to be hair falling out of your head. But when it comes to going for treatments, it's very important to identify what exact cause is there behind your hair fall. So the most common type of hair fall is androgenetic alopecia. Even some women experience it. It's where your genetics and your hormone come into play. So androgen means hormone. So your testosterone, even women have it in a lesser quantity. But when they go through, PCOD or thyroid issues, their testosterone goes up and then it causes alopecia. And then there's a genetic influence playing into it. So this is androgenetic alopecia. Telogen effluvium is where, like I mentioned earlier, when your body goes through a certain stress and then recovers from it, your body prioritizes the important organs. So your hair and skin are kind of least prioritized, and then it starts to get, less prioritized. So it starts to fall, your skin starts to get dull, and all of that happens. And alopecia areata is something actually completely different from everything else we spoke so far. It's actually something I would say as autoimmune disorder. So I would like to compare it to a dust falling inside your eyes. Like, say for example, there's a dust falling into your eye starts to water up and it tries to eject the dust. So it's basically your body rejecting a foreign object. So what happens in autoimmune disorder is that your body thinks your own body is a foreign object and it tries to reject it. Same thing. So when your body focuses on a particular location, say for example the back of your head, or for some people it is a beard, that particular area, all the hair follicles get rejected. So you start having patches of bald spots on your skin, and those patches will be very shiny. Some doctors, they mispredicted and they end up doing hair transplant on it. So it's not the hair's fault, it is that particular location's fault. So when you're doing hair transplant on this, you're going to lose that hair as well. So you focus on suppressing the immune response in that particular area. So the treatment kind of changes for the three different hair loss types that we mentioned right now.
So, speaking of alopecia areata, some people try home remedies like onion juice, right? Does that actually work?
Your onion has nothing to do with suppressing your immune response, so it is not going to come back. Worse than that, I've seen people cut that particular portion with blade and then rub onion into it. It is not going to come back. Some people, when their areata patches are small, after a certain period, like mostly, you don't exactly know why androgenetic alopecia happens. It can happen because of anything. For some people, it is because of stress. Like when you stress out, you see these patches in the beard. But then when your lifestyle becomes better, you've started to handle your stress, this patches for some people goes back to normal. Then they will think like it was because of their onion, or it is because of their, cutting their skin. So they don't directly influence the treatment. For treatment of areata, you'll have to meet your doctors. Corticosteroids help suppress your immune response. So actually, to be honest, everything affects hair, because hair, if you look at the anatomy, it is very loosely attached to your skin. Just suddenly losing weight, you lose a lot of hair. Like I've seen people losing 10 kg, 12 kg in 2-3 months. You'll notice they lose a lot of hair because your hair is attached to your skin by fat, and you burn that fat, the hair falls off. So that is one. And it can be your food. So protein, when your protein is less, you're going to lose hair. When your nourishment, your nutrition, your micronutrients are less, like I mentioned, your iron, your zinc, your vitamin D, your magnesium, all of this is very important for the way your hair is growing. So when your nourishment is less or it's not balanced, you're going to lose hair. Sleep is a very, very important factor. I mean, I've read an article where if you don't have that 11 to 6, that sleep, your brain actually doesn't produce a hormone called melatonin. So there's a gland on your brain called pineal gland. This gland produces a hormone called melatonin, which is actually very good for your hair. That is why you notice all these people doing night shift jobs, they lose a lot of hair because this particular hormone is not produced properly. But now, everything is commercialized, like people started selling melatonin, but it's not as good as the one that is naturally produced in your head. So sleep is very important. Stress, obviously, cortisol is produced when you stress, your flight, fright, and fight hormone. So this can cause hair fall and breakouts also. And hygiene, this heat, you wear helmets, you don't protect it with the cloth inside, you sweat inside your helmet, you wear it, sweat comes back on your scalp. So hygiene is damaged, dandruff comes up, you share combs with everyone, you're staying in a PG, you're sharing comb, you're sharing your pillowcase, it is going to keep transferring. And not using the right products. Some people are, they use hair gels, they use this heating products. It can damage your hair and skin. So literally everything can cause a damage to your hair, because hair doesn't fall because of this one particular reason. It is because of this is multifactorial reasons why you actually lose hair. So when you're taking care of it, you'll have to take care of it as a whole.
What are the ways in which our diet impacts our hair health, ma'am? Like, what can we eat differently after hair fall?
I wouldn't say junk is bad for you. Everything taken at the right proportion is always good, because what is junk? It's your burgers. What's there in burgers? Your chicken. Chicken is protein. Protein is good for your hair. So uh, just cutting down junk is not going to make yourself so healthy all of a sudden. Taking the right food at the right proportion is always important. A lot of people skip breakfast. They think, I'm busy, I'm late for work, I'll just drink coffee or grab an apple. That doesn't work like that. You start your day, your cardinal cycle starts, you have good food, it's going to restart everything. It's going to restart your skin, your hair, all of it. So taking the right food mostly at the right time is what is going to influence your hair. Not having a heavy diet before you sleep, because when you're going to sleep, your body starts to shut down. So having a heavy food at night is just going to do bad, because it's just going to sit in your stomach without getting digested, and then the toxins come out, and then your skin and hair get spoiled. So that is very important, to focus on what time you eat and then what you eat, obviously. So I know a lot of people who take seeds when they wake up, like chia seeds, flax seeds, lemon juice, turmeric. All of this is actually good to restart the body, because it helps increasing your antioxidants in our body. So antioxidants are hair friendly stuffs in your body. So taking these right stuff, taking a lot of protein, taking a lot of green vegetables, iron, and anti-inflammatory. I like omega-3 fatty acids. Whether it's not that popular in India, but then I would recommend everyone taking omega-3 fatty acids as a ritual, at least twice or thrice weekly. Whether you're sick or not sick, as a everyday supplement, it's a very good supplement. It reduces all the inflammations in your body, whether you know it or not. And this is something which directly hits the hair. And vitamin D, obviously. People working from home, they're not exposed to sunlight. So vitamin D in their body goes down. Vitamin D is very good for your hair. So I would say, if you're working from home, at least have that morning walk, 6 to 7 o'clock that walk, and take vitamin D weekly once and get tested, because vitamin D deficiency can cause hair fall. So whether you're eating right, make sure you take some supplements. Your magnesium, vitamin D and omega-3 works real wonders for your hair.
What's the most frequently asked question you receive from your clients, ma'am?
This is something which people will always ask. If I do hair transplant, will my hair fall problem stop? Hair fall has nothing to do with hair transplant or vice versa. Hair transplant is just a surgical procedure where we replace transport where your hair is already there to a place where your hair is not there. So basically taking the hair roots from backside and keeping it wherever you have gap. It has nothing to do with hair loss. So hair transplant is not a solution for hair loss. It is it's a treatment for balding. So if I say, for example, I plant a hair on the sides, the remaining hair which was falling will continue to fall, because it is not going to, help in any ways. So if you have hair fall, first stop that hair fall. At least get it under control. Go for retention treatments. Get your hair fall under control. Strengthen it. You might even get some hair back. Like you would have just recently lost your hair and the roots will still be active. It can grow back. But then the places where you still don't have hair coming back, that is a place you go for hair transplant. So the most common question I get is, if I do hair transplant, am I done for life? Am I not going to have hair fall again? You will have hair fall again. It's just your re-existing hair falling off. Transplanted hair mostly doesn't fall, provided you take care of it. But pre-existing hair will fall off.
So, what are your thoughts on using kitchen ingredients for hair care, ma'am?
Kitchen ingredients, I've heard of onion. Some shampoos come with onion. It helps to an extent. There's no direct contribution towards hair fall, but it is not going to bring back hair that you've lost. All these oils that you use, it's only going to be a nourishment. And if you have dandruff, you're not even supposed to use oil.
Could you make us understand what hair retention treatments are?
Retention treatment is literally anything that is going to help retain your hair. So you'll have to focus on what stage you are in, first of all, and what you're expecting out of the treatments that is going to happen. So if you have hair that is thinning and falling, go for retention. If you've got bald spots, go for restoration. If you've got both bald spot and restoration, do first. But if you had to prioritize, go for retention first. So what exactly is retention? Retention are treatments that are going to help retain the hair. There's a lot of retention treatments. It can be your tablets, your topical solutions, or even say PRP.
So, people in this generation, ma'am, are they really inclined towards hair retention solutions or just hair transplants?
I would say people opt for retention more than they opt for restoration because most of the people are scared of needles. Like I'm scared of needles. So people don't exactly, jump like, okay, I'm going to go under the knife today. But people are more comfortable with saving their hair first. So they go for treatments like PRPs or GFCs or maybe topical solution like minoxidil. So they try all those first. At least now they're trying all these first. Those days they should try, like we mentioned, those onion and all of that. So people try to treat themselves first. If they fail, then they come to us asking for tablets. But I see a lot of people focusing on retention treatment than restoration treatment.
Is it true that men are more prone to hair loss than women?
I feel that's true. I feel men lose more hair because coming to the cause of it, it is 90 to 95% of hair loss is because of androgenetic alopecia, and men are the ones normally having androgenetic alopecia. Women, when they have hormonal imbalance, when they use a lot of chemicals on their hair, or if their hemoglobin is less, the vitamins are less, then they lose hair. But it is a men that normally lose hair. And smoking also, I don't want to be the judge of it, but mostly it is the men that smoke, so the nicotine does cause hair fall.
Does genetics play a significant role in determining hair loss?
Genetics play a huge role in hair fall because people feel like, when they come to my consultation, they're like, my dad has got good hair, but I've lost my hair. It'll be a male patient. I want to say this very clearly is when men lose hair, it is majorly from the mother's side. Maternal genetics is playing a huge role in male pattern balding. It can be your mother's brother, it can be your mother's father. So it comes from the mother's side. For some people, it can be the father's side also. But I would say the pattern that your parents or your grandparents lost, it can be the front, it can be from the side, or it can be completely on top. The pattern is influenced by the genetics, and it's majorly mother's side. For men, it is majorly genetics. For women, it is majorly hormonal. It can be thyroid issues, it can be PCOD, PCOS. So majorly it is hormonal, I would say.
Postpartum hair loss is a common concern for any woman, right? So, can it be prevented or minimized in any way?
It is possible to avoid it. First of all, it's a very beautiful thing, bringing life to earth. So when you're pregnant, when women are pregnant, they normally have good hair. If you notice, their hair is thick, it's shiny. All of a sudden, they've got the pregnancy glow and all of that. It's basically your female hormones all over the place. But after pregnancy, same like what I mentioned in case of COVID, where your telogen effluvium, your body goes into recovery mode. So that's when you start losing hair, you start losing the glow on your skin, and you start seeing pigmentation and all of that. So I'm not saying it's a bad thing, but I would say, it is good to take care of yourself at that right moment. When you start noticing hair, start going for supplements, start taking PRP, go for low-level laser therapy. I wouldn't say go for topical solutions because a lot of people, it's not safe to apply minoxidil when you have a kid at home. So I would say meet your doctor first.
So, previously you mentioned minoxidil and fenistrate, ma'am. How do these medications work?
I would say they're all just supportive treatments. Coming to minoxidil, it's a very popular first line of treatment. So it's basically during the global pandemic, COVID, where doctors were not seeing patients face to face, and it was mostly just video consultations and text and virtuals and all of that. That's when the first line of treatment was minoxidil fenistrate combination. I don't think before that there was much of a hype for it, but after this is where the hype for minoxidil fenistrate came into play. So they're majorly supportive treatments. They are not the end treatment for hair fall. I would say supplements play a better role. Coming to minoxidil, it's basically a vasodilator. Initially, it was known for blood pressure treatment. So it's actually a treatment for when your blood pressure is high or low. They treat it to calm your nerves or your, say, blood vessels, where it controls your pressure and increases the flow. So it basically plays a major role in something called vasodilation, where your blood vessels are dilated, so the pressure goes down, the flow increases. So how does it play a role in hair fall is when you topically apply it, it increases the blood flow, so people are happy, and when they're happy, they end up stopping it. So when you stop minoxidil, it goes to vasoconstriction. So the blood flow cuts down and then you lose more hair. So I would say if you're starting minoxidil, be aware of how you're using it. It's very important to make sure you have a proper dosage. You're proper about it. You're not misleading it or overdosing it or misusing it, I would say. So if you're starting it and you want to stop it, it's better to always taper it and stop. So that's how you use minoxidil. Fenistrate, I would say it's something where it can be questionable. So for some people it works, for some people it doesn't work. It's got its pros and cons as well. So some doctors are very happy giving fenistrate because you see instant results. So what exactly is minoxidil? It is a DHT blocker. So like I mentioned, hair loss in men happens because of androgenetic alopecia, majorly their male hormones. So what people believe is that it's your male hormones overplaying. So control your male hormones, your hair gets under control. But a lot of people experience side effects based on it. So it's something very you can question about it. Some people use it, some people don't use it. I like to play safe with organic treatments. It can be your supplements or say with your blood.
So there are treatments involving one's own blood, right? Could you tell us more about those?
It's majorly focused on the growth factors that your blood is already there. So God made us in such a way that you have the solutions to your problems inside of yourself. So this treatment called PRP, majorly it was focused on your stiff joints or your scars. During COVID they used plasma therapy, so some people get it on their face. But then when it comes to hair, there's no proven article saying that it is going to stop your hair fall. No, it is a defense mechanism. So basically your blood has got defense cells, your WBCs. So your plasma cells major help in repairing something that is broken. So you take it, you inject it in your scalp. Anything is broken, it tends to fix it, but it's not permanent. It's something, then it becomes a lifestyle. You take it as long as you want hair or as long as you have hair loss problem. Basically, I would like to compare it to gym. So as long as you go to gym, you've got these muscles. You stop gym, the muscles go back to normal. Same thing. As long as you're taking your retention treatment, your hair is going to be healthy, or I would say you're going to delay the process of hair fall, but the moment you stop your retention treatment, you are going to lose hair. So when I said blood, I meant your growth factors, your platelet rich plasma. But now there are treatments where a lot of advancements have come. It's not just your blood, because it's already there in your body and it has to be that good for it to work a bit. So we take your blood, we add a lot of other stuffs into it, cocktail of your vitamins, your peptides, your minerals. All of these play a major role in supporting your hair.
Can you share more insights about the advanced hair restoration treatments available today?
Sure, definitely. But then in my next podcast. So comment below the questions that you're eager to, get it answered. And this is Dr. Nikita signing off. Bye-bye.